Staff in the CCU should be aware of dealing these type of patients. The next step comes the cath lab. So, suppose a patient like this come to my hospital, what I will do? I have to reach the hospital very fast.
Sir,
and
come to my Dharamshila hospital. Okay, sir. 1, 2, and go.
Suppose a patient comes to our hospital, Dharamshila Narayana hospital. So, what I will do? I will alert the staff who will be who will be giving the treatment in these type of patients. Immediately, we will take the patients to the cath lab. Any patient has to be taken to the cath lab. Any patient have heart attack, and coronary angiography has to be done. Patients needs a very good counseling. Patients and attendants. You know, heart attack is not a simple thing, simple problem. It is a serious problem. During procedure, the patient can die on the table also. So, a very good counseling is required for before the treatment is started. So, the best treatment at present day is that a patient of heart attack, angiography should be done, should be allowed to flow either by putting a stent, mostly by putting a stent. So, which is available in our hospital. So, we are doing it nowadays. So, this is once the artery which has been blocked and it started flowing. So, the patient's chest pain disappears, his ECG findings disappears, and gradually the patient will be stable. But number one, the most important thing we should remember is that if a person comes very early, suppose a person is coming within 1 hour of having chest pain and all, so he is the right candidate to get the best result. If the time is delayed, 4 hours, 6 hours, 7 hours, 10 hours, the longer the time, the lesser the benefit. So, everybody should be aware that high index of suspicion is most crucial to treat a patient of heart attack, because it is an emergency situation. Apart from angiography and putting a stent, the patient will be kept in CCU and other medications has to be given. And apart from this modality of treatment, suppose a patient is getting discharged, he also need further medications, lifestyle modifications, avoidance of smoking if a patient is a smoker, treatment of blood pressure, treatment of diabetic. So, these are very essential. It is not that you put a stent and everything becomes completed. It is not like that. We have to understand the disease process. So, these things has to be done gradually, and patient has to take medicines for long term. And I think this is a basic idea about heart attack. So,